We appreciate you guys coming back in. We visited a few other times this summer. We just wanted to bring you back in and kind of visit with you about not only are you well-respected physicians in this area, but you're also parents of Holy Savior Menard students. So talk to us a little bit about your comfort level in sending your child back into the school with the recommendations that you've made and the plan that we put in place. So kind of visit with us as a parent what that looks like and what it feels like.
Thanks, Principal Gatlin. I think for me, I'm excited about it. My child's ready to get back to school. We're ready for her to get back into some normalcy and to get back into the routine of being back in classes, being more social, and yeah, getting back to some normalcy essentially.
I am so excited for my kids to go back to school. We all need a schedule. We all need normal life. I'm so proud of Menard for really thinking through this process. I'm so thankful for my colleagues for helping us all formulate a plan. We've been doing a very similar process at my office since March when this started, and it's been very effective and efficient for trying to contain sick people, to quarantine sick people, to keep other people healthy. So I'm so proud of what's been instituted to try to bring our children back and keep them safe. I think Menard is doing the best job that we can given the conditions that we're in, and I am so excited for the start of school.
I would echo the same sentiment. I think the only things that are going to be sad the kids go back to school are our animals. You know, I think that's going to be devastating for them. But I am excited, and I think the kids are excited about going back to school. I know there's a lot of anticipation of getting around their friends and seeing everyone. I know they get together now in small groups, but I think they're really looking forward to it. I think as a physician, you always worry about what ifs, but I think as we've seen over time that life must go on. And I think if we take the precautions that we've talked about, as well as they're becoming standard living now, I think the risks to our kids are going to be minimal.
As we've met throughout the summer, we've made some different recommendations. You guys have made some suggestions. So some of the things that we've done here at the school, we put up more hand sanitizing stations for the students to wash their hands more frequently. We're going to provide the teachers with materials and cleaning supplies so they can clean the desk. One of you mentioned the surface areas, to make sure that we clean those things off. And some of our computer labs and some of our classrooms that don't allow for social distancing, we're actually putting some plexiglass to kind of keep the kids apart there. Social distancing as much as we can. As long as we're in phase 2, we'll recommend or require that students wear masks. And then just this afternoon, we looked at ways to create one-way directions going in the hallways for traffic. We've tried to reduce the large number of large gatherings and try to eliminate a lot of exposure. So are there any other things that you guys can think of medically that we could put in place to increase the safety for our students?
I think all that's great. I think that everything y'all are doing, especially the social distancing, the masks, the hand sanitizer, washing hands. I think the one-way traffic is a great idea. Dr. Batto was talking to me about that earlier today. Unfortunately, he couldn't be here today. I also had some recommendations that, one of the good things about here at Menard is when they are required to kind of be around each other, lunch and stuff like that, the windows can open up at the mall, let some air come through here and help ventilate and circulate some air, which can help. The kids can go outside. And I think that all the teachers are going to be pretty observant, watching them, making sure that they are following all the protocols and all that the whole time. So I think the other thing that I'm very impressed with what Menard has done when this outbreak hit us initially, and the fact that Menard was able to go virtual so quick and so effectively, where so many schools around here were unable to do that or just didn't do it. They've already got that jump and ready to do that for the students who maybe are unable to come right away or are exposed to some illness or something like that. So
I think one other thing I would echo is that I think personal responsibility now comes into an extremely big factor here into keeping our kids safe. and it's going to be observation, used to, and I know we've done it. Our kids maybe had a little low-grade fever and didn't feel well. They're going to school. They would have to be really sick. And I think now that level of encouraging them to go to school, we may have to listen to them and maybe pull them out of school or keep them from going to school if they don't feel well until they feel better, or if necessary, go see a doctor and get checked out and make sure they're okay and they don't have COVID or something like that. But I think that's one thing that we as parents have to monitor and make sure, because I know the school is going to do their part, but we also are going to have to do our part, and our kids as well, to let us know, what's going on with them.
So one of the precautionary measures we're taking is we're going to check temperatures as kids come into the building. A kid that registers a temperature of 100 degrees, 100.4, we'll call the parents and ask that the parents come and get the child. What advice would you give that parent if their child is sent home for that high temperature?
I think the parent needs to call the child's doctor and let the doctor make the decision as to what happens next.
At one point, we had said a doctor's note would be required to come back in. I believe the states kind of changed their guidelines on that. Talk to us about the guidelines of the child returning to school if they've been flagged with that temperature.
Well, I guess that would depend on if they had a COVID positive test or if they had another illness. So it will be doctor's discretion if they have strep throat or flu when they get to return. If they have a positive COVID test, they have to be fever-free for 24 hours and 10 days from symptoms.
We get asked a lot of times, what if my child has been exposed to the virus? What does the parent do? And talk to us a little bit about what exposure means.
Exposure is difficult from my standpoint because I get questions about exposure every day. Was it a minimal exposure? You spent less than 5 minutes with someone and just passed them in the hall and they tested positive? Or is this someone living in your house that you eat with, that you live with, that you share a bathroom with? Those are two very, very different exposures. So I think we have to narrow down what exposure means in order to handle it better. I think a lot of times that may again be a doctor's discretion. Call your doctor, discuss the exposure. Is it exposure enough to pull your child out for 14 days, which is what you would have to quarantine if it was a really significantly positive exposure, because that's a long time to pull your child out of school. And we as docs want to make a good decision and not pull children out of school who don't need to be.
I'm going to echo that 100%. I was telling my colleagues earlier, the exposure that your uncle's son's sister's colleague at work that they saw for 5 minutes in the hall may not constitute an exposure, right? But if your grandmother was positive for COVID and you spent the weekend at their house eating dinner with them and sleeping with them and all that kind of stuff, and that's obviously more of a concerning risk for exposure. So I think it's going to depend on some common sense and then reaching out to talk with your physician about it before the decision is made.
One of the areas we haven't touched on is the mental health of our students. Talk to us briefly about your experience with the social and emotional health of children as they return back to school, and how important it is that they're able to be social and that their emotions are met.
I mean, I think that's one of the most important things that school brings to them. I have a junior high student, I have a high school student. I think that their social and emotional development, especially for junior high, is critical at this time. They have to learn to follow rules, to work in groups, to be a part to be a friend, to solve conflict. These are all things I can't teach them at home by myself. So I think it's critical, and there's great data. Even the CDC has great data on social and mental well-being of returning to school and how important that is to all of our children.
Yeah, I would agree. I'd also like to say that, these students interacting with each other on something other than a cell phone is just crucial. And that's been shown. There's good data on that as well. We've all seen these kids at restaurants talking to each other across from a table on a cell phone, but obviously that's something they can't do at school, which is a great thing that they can't do that, and that they have to get there and interact socially, interact intellectually. It's just huge for their development. And I agree, Dr. Griffin, especially in junior high when these minds are really getting developed. Not to say that's not important in high school, but I think that's a huge, huge aspect of school for these kids.
Yeah, I would agree totally, but the other thing that I'm really concerned about is the toll this crisis will take on their academic learning and what's going to come next, because I'm not sure the colleges are going to let up how they teach or what they require their students, and it definitely will be interesting to see over time how much this does or does not impact the child when they go off, if they go off to a higher level of education. So in my opinion, I think it's critical for them to get back to school and return to function, everyday function as they normally did, and go from there.
So as we close, we want to thank you guys again for giving up your time. We know you're extremely busy in your medical profession, and we feel like we have a pretty thorough plan, and it wouldn't have been possible without your expertise in this. Appreciate your time again, and look forward to visiting with you guys again as the situation changes.